If you have trouble feeling or being aware of the muscles on the outside of the hip working, or if you have a history of some SI joint discomfort kind of right in the back middle part of the pelvis, or if you find that you have a lot of hip dropping when you walk, when you do single leg exercises during your strength training sessions, or when you're running, you're going to want to try this exercise and incorporate it into some of your warm-ups or your active recovery days. The glute med is a muscle on the outside of the hip that brings the hip out towards the side like this. And it's really important for pelvic stabilization, especially when we are moving and standing on one leg. Position yourself about hip width away from the wall. The leg we're going to be standing on is going to be the one furthest from the wall. Foot position here is important. We don't want the toes flared out like this. We also don't want the foot straight from the line of the big toe. I want you to position your foot to where if you were to draw a line on the outside of your foot, that line is going to be straight and parallel with the wall next to you. If you're used to always having your foot rotated outwards, this may feel a little bit different or weird or off for you, but that's okay. That's why we're working on this. Lift up the leg closest to the wall and you're actively pushing out into the wall. We're not pushing like we're trying to rotate the hip like this, because what do we talk about? Glute med does this. So trying to push straight out to the side and into the wall. If you're getting a lot of hip flexor cramping in this leg, you can always drop it down a little bit and bring that leg behind you, because that's going to help the hip flexors in the front of the hip work a little bit less. Super important thing is to try and keep your pelvis level, meaning I don't want to see this hip hiked up super high, and I also don't want to see it up down super low. We want to maintain a nice even pelvis that is going to be parallel to the floor. Once you find a comfortable position, go ahead and squat down just a little bit, just a little mini baby squat. Continue pushing this leg into the wall and driving this foot down into the floor. You should immediately start to become more aware of the muscles on the outside of the hip start working. If you feel more of the back of the hip working, check the position of your pelvis, because if you're kind of dipped forward like this and your back is arched, you're going to feel more in the back of your hip. And the opposite's true, is if your pelvis is tucked too far forward, you're going to start to feel the muscles in the front of the hip, like the TFL and the hip flexors. So find that neutral position of that pelvis. We're not tucked too far under, but we're not sticking our butt out too far. Hold this position for about 3 rounds of 15 to 45 seconds, depending on your strength and the amount of time you need to create the awareness around the muscle. Then if you get really good at these isometric holds, something you can do is perform an active variation of this exercise where we're coming down in a little squat and then we're slowly coming back up, kind of working in through these ranges, continuing to press this leg into the wall, and you are going to light this glute med muscle up. As I mentioned, dose this into your warm-up before your strength training session or your runs, and/or use this during your active recovery days in order to get some isometric contraction, some blood flowing, and even some pain relief if you are dealing with some discomfort.